So Sienna has a very specific question. I'm not sure if I'm going to, this is part of the Q&A by the way, in case I put this in another video, but I'm not sure if I'm going to just leave this in the Q&A or just make a separate video on its own, because it really does deserve its own video. So her question is that, can ab muscles go back to their original position after being separated due to growing and carrying an infant for 9 months? So if you're pregnant, what you're going to notice is that when you're pregnant, your abs, they actually expand and they thin a little bit to accommodate for the space that your baby's going to take up. And what she says is this is for minor cases, not something that would require surgery in most cases. So I'm going to add a caveat to this. If this does not work for you, you're going to need to see a physical therapist. If it's very severe, you're going to need to see a physical therapist. Your doctor should know about this. If your doctor recommends that you go for surgery, go for surgery. But if they've told you that you can just do this at home, here's how you do this. So the condition that you're describing sounds like something called diastasis rectus. And what that is it's a prolonged separation of the abdominal muscles that happen during pregnancy. Now, I'm going to show you an image on the screen, and it's going to show you the different variations and actually, like, anatomically how this looks. Okay, so you've seen that. If your abs look like any of those four things after being pregnant, you have diastasis rectus. And it's normal for them to be like this for a little while after you're pregnant, but if it's a prolonged thing, if this is like 9 months, a year, 2 years after you gave birth to your first child, this is something that you're going to have to deal with. But what you don't do is this. You don't do sit-ups. You do not make all kinds of gains in the ab department. You don't do weighted crunches, you don't do anything like that, because you're making them bulge out even more when you do that. You need to start light. I don't ever recommend that anybody ever start light except for in very specific circumstances like this. And what you're going to want to try to do is as many breathing exercises as possible. Now, before I get into this, I want to show you anatomically what the abdominal wall looks like. So, as you can see, these blocks right here, you know, your six-pack abs, that's called the rectus abdominis, and this is a layer of muscle that sticks out from the abdominal wall. And I know I'm not at 8% body fat yet, I'm getting there. Calm the fuck down. I'm getting shredded, okay? Now, you can't really see it very well on me because I am well above the beach level of aesthetics, but this right here is your obliques, and there's a piece of connective tissue. It's really a muscle that wraps all the way around to your back, and it connects into your back here, and that is called your transversus abdominis, and that's why it's called diastasis recti, because the rectus is dilated. Now basically, in this situation, what you're going to have to do is breathing exercises. So what you're going to want to start with is this, and anyone can do this. I want you to breathe, and I want you to breathe in. And when you do, breathe into your stomach. Breathe deep. Feel your stomach expand, and then when you exhale, contract your belly button into your spine. And the other thing that you can try to do is a very shortened range of motion crunch. And all this is let's say that this wall is the floor. You lay flat against it with your legs kind of, with your knees bent really, like you would start a sit-up with. You feel your belly button pull into your spine, and you bring yourself slightly up. And then you don't go any further than that. And then up again. And try to do that breathing exercise that I talked about while you do that. Give that a try, see if it works, and once you notice them coming back together, you can start to do planks again. You can start to do stabilizing activity.